matter of life and death, emergency life-saving. A heart attack, stroke, or another serious emergency always means a race against the clock for paramedics. Most medical emergencies do not occur near suitable medical facilities, and yet patients must be cared for as best as possible. Paramedics and emergency physicians face tough challenges every day.
Ein Notfallmediziner muss ein sehr gut
An emergency doctor has to be a well-trained doctor who has mastered certain techniques, especially communicative ones, to collect and convey information to assist the patient as best as possible.
Informationsfluss eines akut erkrankten oder verletzten Patienten zu ermöglichen.
Emergency medical equipment must be reliable, robust, and at best, small and easy to use.
Klein, handlich und einfach zu bedienen ist.
Regarding emergency telemedicine, I think we are still in the early development stage. A fax of an EKG is already standard procedure, but the transmission of further information and the distribution of it with other caregivers is still a way off. But we are hoping to make further advances in the years to come.
Weitere Fortschritte zu erzielen.
Patients must be cared for as best as possible in ambulances, in tiny quarters. Therefore, how should ambulances be designed? There are many new vehicles with a suitcase-like packing system. In a room, one can work with right-angle corners. That doesn't work in a vehicle. The fact that emergency instruments are becoming smaller is an advantage for us as space is at a premium in an ambulance. We are thankful for whatever extra room we can find, but of course, things need to be securely attached so that they don't become hazardous. And so, for new, smaller equipment, sometimes it's the mounting devices that still need to be large. Pocket-sized medical instruments are now possible. Currently, the smallest ultrasound device is about the size of a mobile phone, and even the doctor's equipment cases are getting smaller. Smaller, lighter, and more effective. That's the best way to describe the modern medical emergency case. A doctor needs to be able to take care of all kinds of emergencies. This is possible through carefully planned and intelligent ergonomics. Medical cases used to be huge. You can see by this model how small they have become. This is, of course, due to the advances in medical technology. So many devices and instruments have become smaller. Doctors can also make requests to determine the exact contents of their cases as well. So therefore, we have different models. Paramedics are aided by being able to use the most modern diagnostic devices. The first aid sensor has been conceived to check whether a patient needs to be reanimated or not. The sensor is activated upon removal from the protective box, when placed upon the patient's jugular notch, and then it analyzes both pulse and breathing in 10 seconds and decides whether or not the patient needs to be reanimated. Defibrillators are necessary for successful resuscitations. They are becoming easier to use. Defibrillators have a very important role in emergency care, and one is included in every emergency deployment. They've become much lighter and easier to use. They analyze independently, and they have become much safer for paramedics to use.
Und für den Anwender ist die Bedienung deutlich ungefährlicher geworden.